Hello there, Nurse Nelly here. In this video I will share with you my breastfeeding stories and some of the best breastfeeding tips that you need to know as a new mom, or even if you have your second baby or your third baby and you want to succeed at breastfeeding. If you like my channel and you like these videos, please subscribe. This keeps me going. Now let's get into it. So the first thing that you need to do when you deliver, after you have the baby, make sure that you do skin to skin. In the first 2 hours, the research shows that it's the most important time to establish that connection and to get the baby to the breast and to stimulate your milk production. During the time when the baby is on your skin, the first 2 hours, there are 9 stages that the baby goes through. One of the stages is when the baby is actually massaging your breast and touching the breast, and then at some point it's going to be latching on. Even if it's not a deep latch or drinking colostrum, it's alright because the baby is doing her job of starting to stimulate those hormones. Think like an engine. It's starting the engine. That's tip number 1. So skin to skin in the first 2 hours. So when you go to a hospital, make sure it's baby friendly hospital where you can do the skin to skin in the first 2 hours, and let your wish be known by everybody, by your doctors, your nurses. This way you are going to be making sure that they know what you want and they're going to be aligned with this wish. A second tip, when you do get home in the first few days, you're gonna be all alone. You might have somebody, in the family, but you still inside, you're feeling like you're battling all these by yourself. So you don't have to do that. Just join breastfeeding support groups. You can go on Facebook, Luscious Letdown. It's a great breastfeeding support group that is managed by lactation consultants and nurses. We can give you advice in there and we can help you out. You don't have to be alone. It's hard to go to a breastfeeding group in person because in that early time, nap times don't exist. You don't have a schedule. Everything is off the schedule and it's chaotic. So you might be finding very hard to leave your house. That's how it was for me. And remember, the second tip was that you need to have support, because without support, moms quit. The research shows that in the first 10 days, by 10 days, moms that initiate breastfeeding and they want to breastfeed in the hospital, most of them, they just quit because it's so hard not having support, and they encounter problems. And one of the most common problem is nipple pain, because during that time the nipples are getting adjusted to that sucking motion. It's not normal for your nipple to be pulled at, right? And then you also could have other problems like latch issue, that the baby is not latching right, so then the nipple, it's rubbing against that hard palate, and then it's after the feed you can see that the nipple, it's changed the shape and it's like a lipstick, and that's a problem because that's creating your pain. So you need to see a lactation consultant. We do even online consultations, so you can do it from your home. So you can go to lusciousletdown.com and you can book a consultation there, or you can go in your area, the hospital, and you can have somebody help you out. But it's important to get help, because otherwise it's just hard to endure that pain and keep struggling with it. At some point you're just gonna be, okay, I'm done, I'm just giving up because it's too much to take. And you might have other responsibilities, other commitments, you might have other things going on in your life, and you can't just sit on the couch all day and just feed a baby, right? So you feel like this is not worth it. But it's just the first few weeks until you get a schedule, and until that baby, it's transitioning and adjusting to the world. So just be patient with yourself and the baby, because it's worth it. It's such a miracle and such a beautiful experience to be able to breastfeed your baby. And I know that lots of moms feel like they are failing the baby if they are not breastfeeding. If you give it your best and you're trying, if it's not working out, it's okay. You're not failing the baby. What's important is that you feed the baby and the baby is loved and taken care of. So that's a side comment. The third tip, I would say, when you do go to your pediatrician, you're gonna have the first appointments, make sure that your pediatrician knows you would like to breastfeed, and it's very important for you. Because if they don't know, if your baby doesn't gain weight properly, which it happens numerous times, moms come on the breastfeeding support group and they say, my baby is not gaining weight, and my pediatrician said that we must do formula and I should stop breastfeeding, or I should just do 5 minutes of breastfeeding and do the formula the rest. You can work out a plan with the pediatrician. They are not the parents. They are the pediatricians, and of course they want the baby to gain weight, right? So the advice, the professional advice from them, is gonna be to feed the baby. But you can work out with them and a lactation consultant, because the pediatricians, they are not lactation consultants, so they might not be up to date to everything that you could do to help breastfeed your baby. So you can still breastfeed the baby and not just drop the feeding and then you do formula, and then the baby will prefer the bottle, and then your milk supply will drop because you don't put so much demand on producing the milk. And then after a couple of I would say 4 weeks, everything is gonna start to be adjusting and establishing. Some moms, they see a difference around 4 to 6 weeks mark. You're gonna be feeling like your breasts are empty, and from that fullness like you're feeling before the engorgement, it's gonna go to feeling like they are soft and they don't have any more milk in it. Moms freak out saying, oh, is my supply gone? Do I still have milk in there? What's going on? And the answer to that is that the breastfeeding is established, so your body knows how much milk your baby needs, so it's not producing like a fountain like before, because in the first few weeks all the hormones in the body and all the processes and systems, it's still adjusting and regulating, so your body is producing more than it's needed. But then once everything falls on the schedule and it's figuring out how much milk needs to produce, you're gonna see that softness in your breast, and it's totally normal. That doesn't mean your milk is gone. It means that you're producing exactly what you need for your baby, which is great. And let me tell you, with night feedings and day feedings, with schedules and on demand, or how should I be doing, I believe in feeding on the cues, on demand. So whenever you see hunger cues, that's when you should be feeding the baby, and it's not a certain set schedule, because if you are trying to plan a schedule for I need to feed the baby at 8 and then at 10 and then at 12 for every 2 hours, this doesn't always work out. Why? Because you could feed a baby right now at 8, and at 8:30 the baby could be hungry, and then you're gonna be saying, what's wrong? Is my baby not getting enough? Why is my baby wanting to feed again in 30 minutes? And sometimes it's because the baby just falls asleep at the breast and is not taking a full feed, and then waking up hungry in half an hour wanting to nurse more. And to this I'm just saying, we as grown-ups, right, as adults, we have dinner, and then not even half an hour later we go in the fridge or in the pantry searching for some snack, and nobody tells us, oh, you just had half an hour ago, you had dinner, you want to eat all over again. So think about your baby. How is that for a baby that has a stomach as small as a cherry? In the beginning is like 5 mLs they are taking up in their stomach. So of course that stomach, it's emptying so fast. You see how many times the baby is peeing and pooping. So that stomach needs to be refilled. It looks like much, it's not that much. Just put a little bit, a few tablespoons in a glass, and you're gonna be seeing that's not much. So these are my tips. I think that you just have to hang in there. After 3 months, this is a threshold when if you make it to 3 months, you can make it to 6 months and to 9 months and to 12 months. You got it. It's just the first weeks there that you need to adjust, and you need to learn to read your baby, because this is completely new for you. The baby needs to adjust to this world, and it's not an easy task. They come from being inside the womb all wrapped up and loved, and then they come into this big world, and then sometimes we just put them in a crib, we put them in a pack and play, and we just expect them to be sitting there by themselves, but they need our warmth. So if I could give you one tip that really helped with the breastfeeding and with everything in general, would be that you need to keep the baby close, as close as possible. So use your wraps, and that will really make a difference. If you like this video, please subscribe to my channel. Thank you for watching, and I hope you have a lovely day.